Welcome back to Living 808. We're talking health. We're visiting our friends on the windward side at Adventist Health Castle. And I'm sitting here with Dianna Motley, the head of the emergency department. We want to find out, what do you think it is that makes this facility and this emergency department so special and unique?
I think, first of all, it's our mission of living God's love by inspiring health, wholeness, and hope. And, you know, this hospital was built based on our community on the windward side. We needed a hospital on our side of the island, and it's still sustained by that group of people. The people that we see here are our family, our friends, and even our co-workers. That's definitely some of the things that, you know, makes it more meaningful. In fact, one of our mottos is love matters. And we also have another focus of chasing zero. It's one of our evidence-based approaches we take to make sure that no one has harm when they come to our hospital.
Chasing zero, that's something that resonates here, but for people who might not know exactly what that is, can you fill us in?
Yeah, so there's national benchmarks, and there's different things that we measure based on how safe we are. I can tell you that Adventist Health Castle, we stay at the top decile in those benchmarks, and whether that's an infection after surgery or our stroke care or whatever it is, we actually are at the top decile of all those measures. We really try hard to do, like I said, evidence-based practice and making sure that we do things the same way every time, while constantly looking at trying to make it better.
And zero, does that denote some type of perfection or excellence in the craft?
National benchmarks are to have door to CT time and door to doc time within 15 minutes, which is very fast. However, here at Castle, you know, that's not good enough for us. So we have a door to doc within 1 minute, and we have our door to CT within 5 minutes. The reason that's so important, that's how we understand what the diagnosis is, and we can get treatment. You know, every second that a patient is not treated with a brain injury, you know, that's more tissue that's not going to do well. So for us, we blow away the benchmarks, and we are constantly still looking at how to shave off even more time.
Well, besides the stroke care, which you're top-notch at, what other types of patients can you see here?
We can take any array of any emergency that you're having at the time. We do have 24 brand new state-of-the-art rooms. Well, out of those, we have 3 dedicated behavioral health rooms. We have a gynecological room, a dedicated eye room, and of course a trauma room.
We're in 2019, a new year here in the month of February. Anything new on the horizon that could be coming to Adventist Health Castle?
Yes, right now we are actually in the middle of our feasibility study to become a level 3 trauma center. It's something that we really need on this side. We are getting more population on this side, and you know, trauma does happen on this side too. It's just not in Honolulu, so it's really important. It's another service we'll be able to provide for our community on this side.
Dianna Motley, thank you so much for having us out. Of course, if you want to know any more information about this, you can always go to our website, KHON2.com, and look up Living 808 TV. And thank you to our friends over there. We wanted to highlight those services, such a crucial thing, and they have so many great things. That John and I were able to visit the bistro, have the healthy, mostly vegetarian, some amazing meals.
I also think that it's great that they're setting a high standard for service, because it means so much more when you can get things done quicker.
Yes.
Especially for patients that are coming through the emergency room. So I applaud them and thank them at the same time.
Just picture that, too, driving over the poly. We get stuck in the traffic, but you have an emergency and you can't get the services on that side. It's definitely a game changer.
Top notch, for sure.
Right. Yeah.